सेहत है तो सब कुछ है.
Today we will know all about head and neck cancer from a renowned expert, Dr. S Krishnan, oncologist, Srinivasan Rajalakshmi Memorial Hospital, Chennai. Let's welcome Dr. Krishnan. Doctor, welcome to the show. What are some recent advances for treating head and neck cancer? What is meant by targeted therapies?
This means that the patient should know what is meaning of the non-targeted therapies or the chemotherapy. The chemotherapy works by targeting at any dividing cell. That means any cell in the body which is dividing will be attacked by the chemotherapy drugs. Now this is what is producing the most undesirable effects of the hair fall, loss of the blood counts, loss of the mucosa, diarrhea and serious complications of chemotherapy. Now it has been a desire of the medical fraternity and researchers to find drugs which will work only for where they want. So the targeted therapy means the drugs which will go and attack only the target. So for which the cancer cells were thoroughly analyzed. For example, we are talking about the head and neck cancer. There is an EGFR. This EGFR is a surface membrane antigen of the cells which is expressed in majority of the head and neck cancers. Now, this expression means a cancer cell, when it has an EGFR mutation on the surface, it divides very fast. This gives signals inside the cell which make that cell behave as a very bad cancer. Now, the scientists now understood if anything could be done, the head and neck cancer, we have to do it to this EGFR mutation. So, we have now modern drugs which target and goes and gets attached to this. So, now you understand that there is a hole, and if the hole is plugged, then the seepage is going to stop. This cell has a hole in the form of this mutation. The moment that the hole is blocked, the cell is going to stop dividing and it is going to die due to the radiation or chemotherapy and make the person get cured. So, the modern drugs such as the Biomap and Erbutax, they go target this EGFR. We have even drugs like small molecules like Jeftinib and Erlotinib, whose role are yet to be defined in this particular situation. That we have the established molecules, as I said before, the Erbutax and Biomap, they go attached to this substratum. The moment they go attached, they make this cell listen to the treatment. So now you understand that these drugs will not go and attack anywhere else. They will not attack the bone marrow, they will not attack the hair. Though our desire is that we should not have any side effect at all to these drugs. Some of these drugs do have side effects in some regions like skin, causing some rashes. But majority of these drugs are very safe to use and they have no serious complication unlike the chemotherapy.
What is the role of a caregiver when a loved one is undergoing treatment for cancer?
It's very important because unless we have somebody to support, we can never do anything. This is most true in the head and neck cancers because I have not mentioned to you about the complications. The complication, one of the main complication is because mouth is the entrance to the body. When the mouth is affected, one person cannot eat, he cannot speak. So two things happen, he cannot eat, he cannot communicate. When those things happen, only a loved one can really make him feel and give all the comfort. And someone has to make him follow the doctor's advice. One of the common things we advise is to keep the mouth very clean. Many patients who come in the little advanced cancer may require feeding through the nasal gastric tube. So when we give the NG tube feeding must be done by the loved ones. So loved ones have the role in feeding these patients, giving him a reassurance that they are going to be all right and taking care of their moral and physical needs and make the treatment successful.
like, share, subscribe for more such informative videos.